Good day, I'm Pearl Angeli Sabaw from BSN 1B, and today I will be assisting or moving a patient up in bed with the assistance of another nurse. So the goal of this procedure is for the patient to remain free from any injury and to maintain proper body alignment after the activity. Now for the equipment, we usually need friction reducing sheet, a non-sterile glove or PPE if necessary and it is indicated. And then we will also need additional nurse or caregiver to assist based on the assessment, and a full body sling lift or cover sheet if necessary and based on the availability and assessment. Now for the implementation, first I will review the medical order and the nursing plan of care to determine any condition that may influence the patient's ability to move and to be positioned. And then I will also assess for any tubes, IV lines, incisions, and equipments that may alter the process of positioning, and I will inspect for any limitation of movements. And then I will perform hand hygiene after that and put on PPE if it is necessary and indicated. And then I will introduce myself to the client, verify my client's identity, and explain the procedure we will be doing to the client. Good day, sir. I'm Perpo, your nurse for today. May I know your name? How old are you na po, sir? 6 po. Okay, sir. Ngayon po itataas po kayo sa bed ninyo na kasi po na bumababa na po kayo. Okay lang po ba yun? Opo. Okay, thank you, sir. So, still lang po kayo dyan, okay? And then after that, we will provide for the client's privacy. So we will close the curtains around the bed and close the door of the room. And then we will place the bed at an appropriate working height, usually at the height of the nurse's elbow. And then we will place the head of the bed at a flat position or as low as the patient can tolerate, because placing the bed at a Trendelenburg's position will aid in movement if the patient is able to tolerate it. And then after that, we will remove all the pillows under the patient and we will leave one at the head of the bed, leaning upright against the headboard. And then we will have one nurse position on the other side of the bed, and then we will have the railings of the bed lowered. After that, if there is no any friction reducing sheet under the patient, we will place one under the patient's midsection. So let me just call on my assistant nurse. So we will place a friction reducing sheet under the patient. And then after placing the friction reducing sheet, if the patient is able, we will ask the patient to bend his legs with feet flat on the bed surface to assist in moving. Sir, bend lang po yung leg. Kaya po ba? Okay. And then, we will ask the client to place or fold his arm across his chest, and then if the patient is able as well, we will ask the patient to slightly lift the head with the chin to the chest. And then, try na po. And then, one nurse should stand on each side of the bed with feet spread at about shoulder width, and one foot is slightly in front of the other foot. And then, if it is available in bed, we will engage the mechanism to make this bed surface firmer for positioning. Then, after that, we will grasp the friction-reducing sheet securely and close it and put it close to the patient's body. And then I will flex my hip and my knees, and I will tighten my gluteal and abdominal muscles, and then I will keep my back straight, and then I will shift my weight back and forth from the back of the leg to the front leg, and then count to 3. So on the count of 3, we will move up the patient to the bed together with my assistant nurse. And then if the patient is able, we will ask the patient to push or to help in the movement by pushing with the legs. And then we will repeat the process until the patient is on the right position. Okay, sir, tapos i-flip ko yung head mo. Ganyan. Okay. Okay. 1, 2, 3. Very good. So we will assist the patient to a comfortable position, and then we will readjust the pillow under the patient or any other support. Okay, adjust mo lang po, sir. Okay na po. Okay lang po ba kayo, sir? Comfortable po kayo? Comfortable, sir? Okay, very good. And then, we will return the bed surface on its normal setting if it is necessary. And then, after doing that, we will ensure that the patient is the patient's body alignment is proper, and then we will remove other PPE and gloves if we have used, and then we will perform hand hygiene. And then lastly, we will clean transferring aids as per facility policy if it is indicated or not indicated that it is for single patient use only. And then after that, for the evaluation, the expected outcome is met when the patient is moved up in a bed with proper body alignment, without any injury, verbalizes comfort, and the skin is intact, and there are no evidence of any breakdown. Now for the documentation, we will provide areas on the bedside flow sheet to document the repositioning, and then we will also document the time the patient's position was changed, the use of supports, and other pertinent observations, including the skin assessment. And then we will also document the patient's tolerance to the position change, and then the use of aids to facilitate movement. Now that's all for moving or assisting and moving the patient up in bed with assistance of another nurse. Thank you.